Clinical audit of adherence to hemoglobin thresholds for red blood cell transfusion in the perioperative care of hip fracture patients in University Hospital Waterford. Introduction. The perioperative management of anemia is an evolving topic, with recent research comparing liberal versus restrictive transfusion strategies. The Association of Anesis 2020 guidelines for the management of hip fractures highlight a HB less than 8 grams per deciliter as an acceptable reason to delay surgery. Furthermore, our local hospital protocol for transfusion recommends for red cell transfusion at a clinician's discretion when HB is less than 8. Aims to determine if and what proportion of patients were operated on with a HB less than 8, to determine the number of patients who have spent consecutive days with a hemoglobin less than 8, and to investigate further documentation of rationales. Methods. Hip fracture patients over a 6-month period were retrospectively identified. Daily trauma lists, discharge summaries, and labs were utilized in initial data collection. Patient charts were requested and reviewed if the patient was operated on with a HB less than 8 or spent inpatient days with a HB less than 8. Complete case analysis technique was used. Adult traumatic hip fracture patients were included, and elective patients or patients with prosthetic joint infection were excluded. Results. 153 cases were identified. 113, or 74% of the patients, were female, and the mean age was 77.4. Hemiarthroplasty was the most common procedure, and the average length of stay was 22.1 days. There was no evidence of inverse correlation between preoperative HB and increased length of acute hospital stay. 2 patients were operated on with a HB less than 8. Both were transfused intraoperatively and neither rationale was documented. 9 patients had a HB drop less than 8, were transfused on the same day, 5 of which were documented to be symptomatic. 12 patients spent consecutive days with HB less than 8. The longest period was 6 days. None were documented to be symptomatic. A transfusion threshold of HB less than 7 was documented for 7 patients. 2 had a documented rationale. A conservative approach was taken in a risk-benefit evaluation due to increased risk of prosthetic joint infection with RBC transfusions. The average length of stay of these 12 patients was 27.8 days. Conclusion and discussion. Results show incomplete adherence to the guidelines with variability in transfusion thresholds and poor documentation of rationale. Although there was a statistically significant increase in length of stay with inpatient days with HB less than 8, causation cannot be inferred as this study did not account for confounding comorbidities that anemic patients are likely to have, such as plasma cell dyscrasias. There is currently no standardized method in selecting transfusion thresholds for hip fracture patients. The decision is left to the risk-benefit evaluation of the clinician, which can lead to variability in the treatment of patients. Clinicians would benefit from a standardized score that takes symptoms, frailty, and comorbidities into account to guide in the management of hip fracture patients. However, with Cochrane reviews still indicating for further research, it may be too early for such a tool.